All right, I would like to welcome everyone to this evening's webinar. It is Do No Harm does not mean do nothing. And before we get started, let me just orient everyone to what you have logged into here. So we are using Zoom webinar, and so just some instructions on how to use this. We have a number of presenters tonight, and so everyone who is a presenter here is visible. And then down at the bottom, what you'll see is you probably see a little hand function. We're not going to use that this evening. You probably see a chat function as well at the bottom of your screen. And I'm going to ask that you not use this evening because this is what our panelists will be using to communicate with each other. However, we will be taking questions. Most of those questions are going to be answered at the end. And so down at the bottom, you'll see a little Q&A, and any questions that you have, you can click on that to ask your questions. And at the end, the panelists will go through and answer those. And so just a little bit of instructions on just orienting you to the screen. This evening's webinar is being recorded, and so we will make this available to everyone afterwards. And with that, I would like to introduce Dr. Julie Marmon. Dr. Marmon, she is going to give us a report from the front lines. She is an ER trained physician. She is also a former practice owner, and she is president of the El Paso County Medical Society. So Dr. Marmon, I'll hand things over to you.
Thanks, Leisle. I hope everyone can hear me okay. I appreciate you guys joining us tonight. I just know we're all gonna learn so much from the Chungs this evening. And just to give you an update, it seems lots of data from El Paso and Pueblo County, and I'd like to welcome both medical societies tonight for this joint discussion. But we seem to be unable to get much data about what's happening in the front lines. So I am going to be a little bit vague in the way I provide some information, just to respect some folks who are willing to provide some information to me. I do have some good news from Colorado Springs. What we're seeing are declining numbers of admissions for COVID patients. That's encouraging. We're seeing patients get off the vents up here at our hospitals. Currently at one of the hospitals, there are 23 patients who are intubated, but they're anticipating recovery from many of those folks. That's a great direction. That's exactly where we want to be heading. We're also finding there's plenty of ICU beds. There are plenty of ventilators. It looks like the numbers are starting to decline up here, but we do have to be aware because there is some concern that next week we could see another surge. Maybe not the numbers that we saw over the last week or so, but there is some anticipation that we're not quite through the woods yet. So we should keep doing what we're doing up here in the Springs. Pueblo's a little bit different numbers right now. The numbers coming out of Pueblo they are feeling the crunch from this right now. Their ICU beds are getting full. They have plenty of ventilators, but they've definitely worked on beefing that up to maintain their supply of ventilators. But I think as far as communities go, our communities are doing an amazing job managing this, managing the patients, and doing what we need to do to keep things moving and not hit that horrible surge that we're seeing in other places. However, they were quick to add, nothing has changed now. Let's keep doing what we're doing because we are making a difference. The interesting thing that we are seeing is lots of revisions of protocols from EMS. So if you're finding that EMS is handling things maybe different than you've seen in some of your patients in the past, this is by design. They're really taking this opportunity to look at how are we resuscitating people, who are we resuscitating, and who are we placing at risk from resuscitation. So keep your eyes on that EMS data. I'm not going to belabor this. I think we're in a good place for our communities. I will keep getting information as I can, and Mike and I will find a way to update folks. My heart is really with independent physicians, and I'm so grateful that this opportunity is here. And I know the information that comes out of this is going to be so valuable to many of this. And I know there will be further webinars that people can join and learn more. So without further ado, I'd like to introduce the Chungs. I'm sorry, I'm going to pull out my notes because they're so accomplished. I'm not sure that I can even do justice to them. So Dr. Vinh Chung opened Vanguard with Leisle over 10 years ago. They've been in the community ever since and just really pushing the borders and the boundaries of what people can do with independent practices. And I think they're amazing leaders. Dr. Chung graduated from Harvard Medical School and is a Mohs surgeon. Leisle Chung has an MBA from Harvard Business School, and I didn't get to ask them, but maybe they can tell us later. Did you actually meet at Harvard or long before that? Stay tuned. And they've really just spent the last 10 years in corporate growth strategy and operations. Leisle before doing that before Vanguard. So please teach us what you can. Thank you.
Thank you so much. So I will start off and talk about leading during this time. So we are in the middle of a healthcare pandemic, and yet ironically, as we're in the middle of all this, medical practices are really struggling right now to stay afloat. And so that's why we wanted to have this session, just so we could share some of the lessons learned and to help as many practices as possible just to make it through this very challenging time. What I'm going to do at this moment is share my screen. So just give me a second here while I get this going. All right, now if one of my panelists could just give me a nod and let me know if you can see the screen. Yes, okay, great. All right, so for my session, it is just going to be practical advice on practice management during a crisis. And I'm happy to take questions at the end as well as we go through this. The reason we wanted to do this is just really to help private practices that are on this call. I'm going to give a brief case study on how COVID-19 affected our own practice, because we are very much in the middle of this, as are many of you. I'm going to outline some key steps in managing through this crisis, and our goal is to help as many other practices in our community sustain for as long as possible, so that we can all make it through successfully. Because we do believe this is temporary, we are going to get through it, and we want to make sure that private practices are healthy and strong as we get through this. Just to give you a little bit of background, so I represent Vanguard Skin Specialists, where I'm the executive director. So this is a dermatology and plastic surgery practice. The focus of what we do, it's primarily medical. We take care of a lot of diagnosis, or we do a lot of diagnosis and treatment of skin cancer, but really the full suite of general dermatology and plastic surgery. And we have multiple locations in Southern Colorado. We have a team of 12 medical providers, and then overall a team of 70 plus. And then this is what we experienced as COVID-19 hit. And so the chart that you're looking at here is data that I'm sharing with you in terms of our own practice. And this is the percentage change every week in terms of our number of appointments. That is the gray line. And then in yellow, it shows our RVUs. And so you can just see this fast and quick drop that we experienced as coronavirus came into our community. And so in the beginning, kind of early March, we were doing what everyone else was doing. We were continuing to see patients, but we were screening patients. We were employing social distancing measures. And then from there, we started to reschedule non-essential visits and all of our high-risk patients, particularly as guidance started coming out from places like the American Academy of Dermatology and the American Society of Plastic Surgeons. And then very quickly, we just started canceling all of our patient visits unless they were urgent and unless they were essential according to the executive orders that came through and additional guidance coming through our medical societies or the national medical organizations. And so you can see in a 2-week time period, a really hard drop is what we experienced as a practice. So we dropped by over 80% in terms of our volume. And as this was happening, we realized that in order to stay connected with our patients, especially those who needed continuity of care, even though we couldn't bring them into the office, we needed to roll out telemedicine very quickly. And so on Monday, March 23rd, that's when we began virtual visits. And you can see we're kind of on this climb up as we've been rolling out telemedicine within our practice. And when we first started, it was 3 medical providers just testing it and then gradually bringing more medical providers on board. So I wanted to share this picture just to let this group know that we're very much in the middle of this. And I know that especially specialty practices have been experiencing this. The guidelines and restrictions that came through, they were necessary. They are necessary for the protection of our community. And this is, however, the result that we're seeing within private practice. As all of this was happening and we experienced this drop, I told our team it felt like we had been dropped into the middle of a lake. The lake is deep, it is cold. We're being told that we need to swim to shore. I very much recognize that the people who feel this the most are the physicians who are in the front lines and the healthcare workers who are in the hot spots. They feel this more than anyone. As private practice as well, I know that many of us are feeling this too, because we've experienced this drop in terms of the volume, and then it's unclear how long do we need to swim? How far is the shore? What do we do, and how do we get to shore? And so my hope during this session is that for all of the practices out there, that as many practices as possible, that we make it to shore together. So what I'm going to do is break down just a basic playbook. What do I think are the 5 key steps in terms of navigating this and making sure that your practice makes it? The first is I would say, understand your cash position on a weekly basis. So as physicians, to monitor the health of your patients, it's like monitoring fluid and calories. What is the intake and what is the outtake? In the same way, we need to monitor the health of our own medical practice. So every week it is trying to determine what is your starting cash position and what is your ending cash balance every week. So as soon as I started seeing the drop happening, this was the very first thing I did. I modeled out cash on a weekly basis and made a forecast to say, all right, what's happening? Because only if we have this as the vitals for a medical practice are we able to start making decisions and understanding how these decisions are going to impact the health of the practice. So build out the model. Your first input is going to be the net collections. Take your accounts receivable. You know what that lag looks like. Break it out by month. Take that lag all the way across and just start to forecast out every week how much cash is going to come in. That's your input number 1. Input 2, list out all your people on a spreadsheet and start to model out what does this look like by week in terms of the personnel cost that I'm carrying. Then your third spreadsheet, it's all your other expenses by week, and then all the adjustments that you're making in terms of reducing frequency of deliveries, cutting back on purchasing of supplies, all of those decisions that you're making. Model it out, determine how it's impacting your cash. And then last, take a look at your capital expenditures. So what are your major planned investments and how are you going to move that to impact cash flow? And model out your scenarios. Usually when I do this financial model, I'm looking at a base case and a worst case. This is one of the times where I would say, assume your worst case scenario, model that out so that you can start to make decisions around what it is that you need to do as a practice. So I would say this is the very first thing. I look at this twice a week. Twice a week, I'm taking a look at where are we on cash and what do I think it's going to look like for subsequent weeks, especially since things are changing so quickly. The second thing I would encourage you to do, it's really the area of managing HR. This is definitely for me the hardest area because it's an area where there's a lot of emotion. For many of you who have private practices or you're leading teams in other areas, your people, they are your greatest treasure. And so there's a lot of emotion tied to this. So what do you do in this area? When your volume has dropped, I think it's really important that the work that everyone does, it has to be meaningful. Whenever you go through a drop like what you experienced at our practice, there's going to be a group of people, they're working like crazy. They're working nonstop to respond to this. And then there's another group of people, they're sitting around. So every week you're just having to shift, make new assignments, because when you're in the middle of a crisis, you want to make sure that every single member of your team is focused 100%. You have to have that. You can't have people sitting around. And so make sure there's meaningful work being assigned to everyone. Then if you have team members who are remote, we certainly do, I think a lot of people do, outline all the clear guidelines on what that looks like. And then if you've had to reduce hours for your team, I would recommend that you go look at the Colorado Workshare program. So if you're reducing team hours anywhere from 10 to 40% for folks, this program can help fill part of that gap. And then if you are in a place where you have to reduce the size of your team, the advice I would give is one that surgeons say, you measure twice, you cut once. So here's what I mean by that. Whenever you go through a situation and you find that you have to downsize your team or you have to furlough people, you have to make really tough decisions, you want to do it once. And the reason is that if you do it one week and then you cut a little bit more the next week, and then you cut a little bit more a couple of weeks after that, it is brutal to your morale. It's brutal to just the sentiment that people have, because then they're constantly wondering, when is it going to happen to me? And so I would say, take your time, decide exactly what it is you need to do, and then it only happens once. And it's better if you do that and you bring people back instead of doing it as death by 1,000 cuts. The other thing I would encourage you to do is step back and think, all right, is it mandatory for me to reduce my team size, or is there another path that I could potentially take, and start making some decisions around that. For us, we ended up taking the path where it was voluntary, and I will just give you an example and talk through what we did. In the event it's helpful for any of you who are going through this and trying to make decisions around what to do. So our case study on what we did from an HR perspective is, when all of this was happening, we said we are going to take the perspective that leaders eat last. I believe this comes from the Marines. So we said leaders eat last. And so the first thing is the Vanguard board got together and we said, we're going to cut our own base pay 80 to 100% in order to protect jobs. And then we're also going to acknowledge that we may have to actually put funding in, and we're going to do this to keep our people working. So that happened on a Wednesday night. And then the very next series of days, it was meetings with other members of the team. So Vanguard physicians met and decided to cut base pay about 60%. Then the nurse practitioners and the PAs met, decided to cut about 30%, and everyone did that in order to protect their team's hours. From there, on a Saturday, the managers got together and made a decision to do a 10% cut. And then in addition to that, to work more and increase their hours significantly in order to make the changes that we needed to make going forward. As all of these cuts were happening, I will say there were folks who raised their hand and offered to do so much more, managers who offered to cut pay over 50%, medical providers who offered to go without pay. In the end, we decided we need to move together as a group. So this was the group decision that was made on what we would do. And it's because we felt like the sacrifices needed to be made disproportionately at the top of the organization. From there, because things were moving so fast, it was an all-team meeting that took place on a Sunday morning, 9 a.m. So a virtual Zoom with every member of the team getting together. And we outlined just very clearly, this is what's happening to our practice. You're going to walk in on Monday morning and 90% of the patients are going to be off of the schedule. Here's why. And then here are the decisions that have been made at the top. And so we were just really open, really transparent with the team. And we said, we wish we could tell you all these cuts are enough, but it's not. And so from there, what happened, and this was the amazing thing, is that 2/3 of the team stepped forward and they offered to also make sacrifices. And so we have people who have voluntarily gone on leave. We have people who have voluntarily reduced hours. And this was even before the care package was passed and before people knew that the unemployment benefits were going to go up. So how did this work? I think for anyone who wants to take this path, it's really important for the cuts to start at the top in order for this type of path to work. And I share this just in case others are going through the same experience and they're wondering, how do I move forward and how do I handle the HR aspect of the decision? All right, the third piece of advice, it's bridging the gap. Because even after all of that, I will tell you, we still have a very big gap. And there are a lot of sources of funding out there. I'm not going to go into these in detail because the medical societies here locally are actually going to host another webinar going through all of these funding sources. But there's a lot out there right now, and I would encourage folks to go out there and look into these. The one where time is of the essence is the Paycheck Protection Program. That is going very quickly. A lot of those funds are being dispersed. So if you have not applied to that one, please look into it right after this webinar. Get your application in right away. All right, number 4, what do you do? I think right now, everyone is in the day-to-day. We are operating week to week to react to what is going on. But I think in doing that, we need to make sure that we look beyond the crisis and determine what is our organization going to look like when we reach the shoreline, because all of us, we are going to reach the shoreline. And I think we need to start thinking through, what do we do? What do we want to look like? So looking at the long term first, look at your strategic opportunities. Are there new opportunities in this current environment? And what do you think is going to be different at the end of this year? And start to plan ahead on what your organization looks like for this. So some examples, one is telemedicine. We never thought about telemedicine. And then now here we are, where over 90% of our visits are being delivered via telemedicine. We are doing hundreds of these every single week. And so it's a new opportunity for us. It is allowing us to also expand our geographic reach. And we're finding that patient satisfaction on this is very high. This is also a topic that the local medical societies are going to address. So I encourage you to attend those future webinars. The other opportunities we're finding are online connections with our patients. The reason we even have this Zoom platform right now with webinars is because we are hosting webinars with our patients, educating them about skin issues and staying connected. And then we're also looking at how do we develop expertise in new areas. And so our medical providers are doing research right now. For instance, one is going deep on cutaneous manifestations of coronavirus on this. And so think through what are the strategic opportunities for your practice, because they are there and there are opportunities that are there. The second area where I would encourage folks to look long-term is operational improvement. I'm sure you have a long list of things that you would like to improve within your practice and you never had time to do it, and now is the time. So what are the things that you could improve internally? So I'll give some examples on our end. On our end, our check-in process has always driven me crazy. Like, why is it in this day and age that we still hand patients a clipboard with a bunch of paperwork and ask them to fill it out? We can do better than that. And so we are revamping our entire check-in process. We're doing remote check-ins, we're limiting paperwork, and we're limiting the amount of time that someone has to spend at the front desk. We're relooking at all of our reminder systems. We're rewriting all of our internal standard operating procedures. And then we are looking at all the metrics and reporting that we have within the practice. So step back, think through what are the operational improvements that we can make right now when volume is down. The third area that I would encourage you to look at is your people development. And so where could you invest more in terms of your greatest asset? If you didn't have time for team trainings before, you probably have time for team trainings now if your practice looks the way that ours does. So I'll just give you some examples of what we're doing. Our entire medical team, they've started doing a weekly book club. So on Monday evenings, they do a Zoom. So for instance, yesterday, they discussed Man's Search for Meaning by Viktor Frankl. And then on Wednesdays, the entire medical team is getting together and they're doing didactics on a variety of dermatology and plastic surgery topics. So our medical providers are meeting now more than ever. We're also doing team Zoom training sessions. It's 30 minutes over lunch or at the end of the day on various topics. And so it's great team building, and it's everything from leadership skills to how do you work together as a team to more kind of basic processes that we're teaching within the practice. And we're doing a lot of cross-training within our teams. And so I would look at this as an opportunity to develop the team so you can be stronger after all of this. And then last, I would say, look at mission and culture. So how do you strengthen your culture and what you stand for? Because the messages that you talk about and the values that you uphold, it's during times of crisis that they become even more clear. And so this would be the time to really think through what is our mission, what are our values, and how do we make sure that this is loud and clear during a crisis. If you say, you know what, we've never really thought about our mission or our culture or our values, I would recommend a book by Pat Lencioni called The Advantage. We did this together as a medical practice about 2 years ago. It was a transformative experience, so I would recommend that now. And I would really think through, all right, what do we do in this area? So just to give you some examples of things that we're doing in case this is helpful for you. All of our medical providers have decided that they're going to do telemedicine visits on Fridays, and those are going to be what we call free Fridays. So anyone who's affected financially by coronavirus because they've been laid off or furloughed or their business is closed, we're going to do those visits for free. And we felt like this is one way that we could contribute as a practice. And so there are probably other ways that your practice could potentially contribute at this time. It's not only a great way to give back, but it's been great in terms of just the culture of our practice and our team being able to rally around that. We're also planning our next humanitarian trip. We do a trip to Haiti every year. We had a team that came back in February. It's going to be next year before we send the next team, but we're starting that process now, and it's enlightening when you think about our situation, and then you think about a country like Haiti, which has 11 million people and 30 ICU beds in the middle of the coronavirus pandemic, and it gives our practice a whole new perspective and appreciation and gratitude for where we are. And then just opportunities for community outreach. So just kind of, I hope that sparks some ideas for people on the group on, all right, what are some things we could do so that we can look long-term? All right, my fifth piece of advice and last one in terms of managing the practice through this, it is how do you communicate during a crisis? Because I think communication is key during this time. It has to be proactive. Say things before it happens. Sometimes that might mean that you're calling meetings like on a Sunday morning at 9 a.m. Be really proactive. Assume that your employees are not going to come to you with their questions and concerns. And so you've got to be really proactive and acknowledge what they're thinking. Say things like, you know, you're probably worried about your jobs right now. What I would say to you is, and just acknowledge things head on and give responses and say it before it happens. And it's okay if you say, right now, I don't know, especially since there is a lot that we don't know, but just be proactive and frequent and be real, be confident, be realistic. This is not the time to have the let me be a cheerleader and super optimistic type of conversation, but it is the time to be honest and transparent. And then communicate way more frequently than you ever have in the past. Be really repetitive. And when you get to a point where you're tired of hearing yourself is probably when your team is finally starting to hear you. So, you know, I'll just give examples. I've been doing daily meetings with my managers, so they're probably getting really tired of just seeing me on Zoom every day, but it's been necessary. We have been doing company-wide fireside chats. Every Sunday, I send an email to the entire team. Every week, we also do a team huddle that lasts for 10 minutes. Twice a week, I'm seeing the providers in meetings, and then there are also a lot of individual messages that are going out. So it's just a lot of repetition, but the team needs that as you go through a time of uncertainty. And then last, in terms of how you communicate, do it in a way that is visually meaningful. So you have to paint an image that brings meaning to the journey. So right now, the way that people are experiencing coronavirus is there are a lot of random events that are happening. You get a set of news, you hear statistics, and so there's a lot of randomness. But I think as you are a leader within your organization, what you can do is start to bring all of that together and to create meaning within that experience. So for example, I talk about being dropped in the middle of a lake. And we use this metaphor a lot now within our practice. And the way that we talk, our language is all about this lake, and it's all about how we're going to swim together, and we're all going to make it to shore together. And so now we hear the team adopting this, and people saying, well, we're going to do this because it's going to help us reach the shore. Or the fog has come in today, but that's okay, we're going to reach the shore together. And so think about what is that metaphor that gives meaning to everything that you are doing within your practice. The second area, an example that I will give, is we talk about how we're really living out a story. So my background is I'm Korean. I had grandparents who would tell me stories about the Korean War. I have parents who told me stories about what it's like to grow up in post-war Korea. And when I think about stories, I think, you know, right now we are living a story. And at some point, all of this is going to be over, and we are going to tell our children and our grandchildren and people in our lives the story of COVID-19 and what we did during that time. And every single day as we make decisions about patients and about our teams and about our practice, we are writing the story that we are going to tell. And it could be a story of self-preservation, or it could be a story that is so worth telling. And so this is what I tell my team, and this is what I would tell all of you on this call, that as we go through and we navigate this and we lead our practices, we have an opportunity to write a story, and we should think ahead and think, when we're standing on the shores, when we have come out of this lake, what is the story that we want to tell, and what is the story that we will have lived? So that is it in terms of my advice in the playbook of how is it that we manage this. I'm happy to take questions at the end. And with that, I am going to hand things over to Vinh Chung, who's going to talk about leading when in crisis and how physicians can respond.
Thank you. Thank you, Julie. Thank you, Mike and Cheryl, for having us here this evening. And thank you, Leisle, for keeping our practice going. And thank you all of the healthcare workers on the front lines. Just thank you. Thank you for all that you do every single day. I want to first of all acknowledge that as a dermatologist who sees patients only in the clinic, I am not taking the same level of risk that the frontline healthcare workers are facing every day. At the same time, I do believe that we're all part of the same broader medical community, including all the physicians and healthcare workers who work outside of the hospitals and in the community clinics. Whether we're specialists or primary care providers, we're all in this together, and we all can be part of the same solution. And I believe that it's not only our responsibility, but it's our privilege to be able to help our colleagues and to protect our community. Leisle shared with you a bit about what actions we've taken to respond. I'd like now to share briefly about why we responded the way that we did. Let me first of all start by sharing with you a statement from Viktor Frankl. So Frankl was a Jewish physician and a Holocaust survivor. And after seeing the horrors in the concentration camp and surviving it, he wrote this. He wrote that forces beyond your control can take away everything you possess, except one thing: your freedom to choose how you respond to the situation. That was one of his takeaway from surviving the Holocaust. And so right now, the coronavirus pandemic came on suddenly. It threatens to take away everything that we have. We can lose our businesses, we can lose our jobs, or for some of us, we can lose our own lives. So in the midst of fear, of anger, frustration, anxiety, and all the emotions that run high during a crisis, there can be a lot of panic, a lot of confusion, and maybe even a sense of helplessness. I think that we all must first of all accept that there are some things that will happen that are beyond our control. Because despite every effort that I make, I do not have a guarantee that I will not get sick or that I will not die from this virus. We all can also not guarantee that our businesses or medical practices will survive this crisis. These things that are beyond our control can happen to any of us. However, like Frankl said, we still have the freedom to choose how we respond to the situation. And so this is where we must focus all of our energy, our response to the situation. The pandemic is not something that we can run away from. It affects every person, every industry across the globe. And for many businesses like movie theaters, they did not even have the option to fight. They had no choice but to shut down and hope for the best. For our medical practice, we have this option to shut down. And it would have been the easier option by far. We could have furloughed all of our staff and hunker down and wait until it's over. It certainly would have been the least costly way to ride out the pandemic. But we do not choose to shut down because we believe that we have a responsibility to our patients, to our staff, and to our community. When we are faced with a threat, we all experience fear at some level. And it's a natural emotion. But when we leave fear unchecked, fear can paralyze us. And so instead, if we focus our energy on the people we care about and focus on finding ways to protect them, it is through that that we can find strength and courage to take productive steps. It is the desire to protect others or the love of others that is perhaps the most powerful force that humans have. There's a verse in the Bible that speaks about this concept of love, and you might have heard it read at weddings before. It goes, "Love is patient, love is kind. It always protects, it always trusts, always hopes, always perseveres. And so love is not just a feeling that we have when things are going well. Love is actually a verb. And from a Christian perspective, love is actually a command to act. And if we can follow this command to love others, to care for others, I believe that it would take us through the most difficult and darkest hours. And at the end of the day, it is love that will help us to persevere as a community. Personally, I have accepted and embraced my mortality a long time ago, and death does not scare me. What scares me is that when this pandemic is over, that I look back with regret that I did not do enough to fight it, that I did not do enough, did not do more to protect our patients or our staff or our community. And one day, when this pandemic is over, wouldn't it be amazing to look back at this time and to see that it was a time that brought all of us together in this community? That is a time that brought the best out of us. That is a period that made us more courageous and more loving towards one another. It is a time when we can come together right now, where we can fight together, where we can fight for each other. We fight for our patients and our community. And it is really this hope that we have for this community that has led us all here to bring everyone here tonight. And so thank you all for joining us tonight. And so I will now turn this session over to the Q&A portion, and I'll turn it back to Leisle now.
All right, thank you. So everyone who has joined us this evening, thank you so much. What we'd like to do at this time is just open it up to Q&A. Everyone that you see on the top of your screen, the panelists would be happy to answer questions that you have. Down at the bottom, you can see a little Q&A symbol there. So if you click on that, you can type in your question, and then we will take questions. So I will just hold on for a moment if anyone attending has questions that you would like to ask. All right, I do see a raised hand, and let me see here. I don't know that we can use, I'm sorry, I don't think we have, okay, hang on one moment. Let me see if I can do this. All right, so I am going to do a function called allow to talk, and so here we go. I've turned it on, and
Dr. Hollister.
Good evening, and thank you so much for an excellent presentation, inspiring and extremely informative. Thanks to EPCMS as well, and Julie for putting this together. Leisle, you have such a wonderful presentation. I just wanted to mention that with the telehealth, it is wondrous what has happened to the physician community. Prior to the COVID outbreak, approximately 10% of all the physician community nationwide was using telehealth. We have constantly talked about the administrative problems that happen in physician practice and how that prevents us from caring for patients with both the compassion and efficiency that are available through this medium when used appropriately. Literally over 1 or 2 nights, the adoption of telehealth has exponentially exploded to where approximately 90% of America's physicians are now using it. Just want to make everyone aware that at physiciansfoundation.org, of which EPCMS is a member and has a seat at the board, physiciansfoundation.org, there is a significant amount of information about telehealth for practices who wish to adopt it. This has to do with one of the grants that was done by the Physicians Foundation in conjunction with AMA, Texas Medical Association, Florida, and numerous other states. So please go there and look at some of that information. And again, thank you so much for your excellent preparation and great information.
great, thank you so much. All right, any other questions? So we can do the Q&A down at the bottom. You can type in a question, or now that I figured out how to do this raised hands function, you can also raise your hand and I can unmute you. All right, here we go. Let's see, Dr. Hoare, you are unmuted. Oh, sorry, let me try that one more time here. You may have to do it on your screen. I see a little.
Can you hear me now?
Now we can, yes.
Okay, now you can hear me. I want to take this opportunity to thank everybody for putting out this webinar. It was very informative, very good. I just want to give a few updates for the community, especially the healthcare community. We have a patient of mine have donated $1 million, and I have been working with the foundations, UC Health and Penrose and Francis Foundation. And so the money is, they're in the process of buying more PPEs, including ventilators, and also providing meals and groceries for the first responders. And whatever the foundation needs the money is there for them. Okay, so that is the first step. The other project that I'm working on with my private patient is making or try to make and distribute face masks. So I have communicated with the local industrial company that used to make face masks for gas. It's a gas company, but they are we're using the fabric to insert into the mask so that it can be become hospital grade. So we're planning to send out a few thousand masks for all the healthcare workers, practices, individual practices, their staff, and their family, and we can provide cloth masks, face masks for the family. So that is the contribution that we are giving. The $1 million is already in the foundations, both foundations, and currently we're going to distribute the face mask to everybody in all the healthcare practices, their staff, and their family, including care and share, nursing home, and also rehabilitation centers.
Great. Thank you so much for giving that update.
Okay, thank
That's
you.
awesome.
Thank you. All right. Any other questions or any other comments?
Yeah, Leisle, I'll ask you. I will actually ask you a question just while we're waiting for some to come in. You talked a lot about, or we've talked in the past week or so about the rapid shift to telemedicine for your practice, and how I think you told me roughly 95% of your patient encounters now are telemedicine. From a functional standpoint, what was the most challenging thing that you had to overcome during this whole process?
So when we started, we outlined a process of what we thought it was going to look like, and where we landed, it looks completely different in terms of the process. So we found that the bottleneck happens in getting the patient online. And so what we have to do is, we'll do just about anything. I mean, we have Zoom healthcare version, we'll do Doxy, we've got accounts on both of those. We'll also do FaceTime. So we'll do just about any platform. We'll also do photographs and phone. Despite the fact that we are trying to be as flexible as possible, it can still be challenging to get patients connected in. And so what we ended up having to do is a front desk person will call the patient, handle the check-in process, and then walk them through the steps of getting them connected with their medical provider. That is the most unpredictable part of the process, because for some folks, it's 10 seconds, they click the link, and then they're on. Sometimes it takes us 45 minutes, where literally they don't even know how to take a photo on their phone. So, I mean, it's just a lot of unpredictability in that process. So that has been the biggest challenge. Once they're on, it's been easy. We haven't really had any issues. Obviously, we can't diagnose everything through just telemedicine, but the satisfaction has been very high. It's just getting the patient connected, and sometimes some patients find that challenging.
Excellent, thank you. And just a quick follow-up question, and then I promise we'll get back to, hopefully this has given everybody some time to put in some other questions. One of the trends we're seeing, and we're going to be talking about this on Thursday evening's webinar that's going to do a deeper dive on the functional side of telemedicine, is that patients have been the patients who have gotten on board with telemedicine and started using it have come on board very quickly with it, and they love the convenience of it. Are you finding that the patients in your practice, and actually maybe this is a question for both of you guys, but are you finding that the patients in your practice are going to want to see that continue after we're allowed to reopen?
Yeah, so I was actually very surprised at how appreciative the patients are of telemedicine. I think for one, it's just nice for them to connect with someone because who knows how long they've been sitting in their living room. So I think just knowing that they're cared for, and a lot of times too, we can't give them the definitive diagnosis, but we can say, hey, you know what, we're not certain what it is, but this is something that can wait 2 to 3 months. And so I think giving that reassurance, they're happy with as well. But going forward, yes, for a subset of our patients, especially those who are driving from 2 to 3 hours away, this will be the way that we would prefer to have at least the initial consultation, so that it'll save them a lot of time and a lot of gas so they don't have to drive 2 to 3 hours for us to talk about the surgery.
So I do have one question that came up, which is, could you give the name and author of the book again that you mentioned in your presentation? So the author is Pat Lencioni. It's Lencioni, so Pat Lencioni. He wrote a book called The Advantage, and he's also written a lot of other books that sit within what we call our Vanguard Leadership Library. These are the defining books for our practice, where all our providers and our managers read these books. And so I would recommend him highly. The other book that other couple of books that he's written, which are great. One is The Ideal Team Player, and the second is The Truth About Employee Engagement. So they're just very quick reads. They're written kind of as a parable or a fable. So just a great author, and writes about how to create healthy company cultures. All right, and then I don't see any other raised hands, and I don't see any other questions coming through. And so I will just say thank you to everyone who joined this evening's webinar. We'll probably send a survey out afterwards just to get comments and feedback. And then if there's anything that you heard tonight where you'd like to do a deeper dive, we'll ask for feedback on that so that the local medical societies can plan ahead on future webinars. So thank you everyone for taking time out this evening and for joining us.